The situation at a Dallas hospital is getting worse. Another case of Ebola was diagnosed late last night. Good evening, and thank you for staying with us for News 10 at 5:30. I'm Lydia Colbita, in for Elisa Streeter.
And I'm Mark Baker. A second employee of Texas Health Presbyterian Hospital to catch Ebola has been identified.
Amber Joy Vinson and her fellow nurse, Nina Pham, both cared for Thomas Eric Duncan, and both presumably were infected by him.
And with growing worries over the Ebola crisis, the CDC is now changing the way it responds to Ebola in the U.S., admitting it could have done so more quickly at the Dallas hospital. It's our top story tonight at 5:30. Marcia Gonzalez is in Dallas with more.
A second Dallas nurse now battling Ebola. Amber Vinson coming down with a fever yesterday, driving herself here to the same hospital where she, as well as nurse Nina Pham, contracted the virus while treating the Ebola patient who died here last week.
This is a person with their life before them, and a person who is dealing with this diagnosis with the grit and grace and determination that Nina has dealt with the diagnosis.
Vinson and Pham, part of a team of 77 people who cared for Thomas Eric Duncan, all being monitored, but their travel not restricted. Something the head of the CDC says may have been a mistake after learning that Vinson was on a plane Monday, traveling on Frontier Airlines from Cleveland to Dallas just one day before she started showing symptoms.
It's definitely very concerning.
The head of the CDC addressing those concerns today, saying there was little risk to other passengers.
But we're putting into place extra margins of safety, and that's why we're contacting everyone who was on that flight.
Vinson's neighbors also contacted, her home and apartment complex where she lives alone being decontaminated, as health officials continue looking into how she and Pham were infected despite wearing protective gear. Still concerned that some of the other healthcare workers who cared for Duncan and are now on administrative leave could also have Ebola. And Vinson is being transferred to Emory University Hospital in Atlanta, where they have a biocontainment unit specialized to treat Ebola patients. We're told for now, Pham will continue her treatment here. Marcia Gonzalez, ABC News, Dallas.
While there is no imminent threat of Ebola spreading beyond Dallas right now, local hospitals continue to take measures just in case.
News 10 ABC's Jennifer Lee shows us some of the things being done around our area should the capital region be exposed to the virus.
Local hospitals in the capital region like Albany Medical Center say they're closely monitoring the situation in Dallas, Texas. As of this morning, we know that a second healthcare worker has tested positive for Ebola. A spokesperson for Albany Med says they're following the CDC and the state's Department of Health recommendations. AMC healthcare workers have also been participating in weekly phone calls with the state and are reassessing the situation on a regular basis. Ellis Hospital in Schenectady says their staff is prepared and they actually have an Ebola task force. The director of infection prevention says their preparedness is really no different than any other infectious diseases they might encounter. We also spoke with Saratoga Hospital, who has a response plan put in place. I'm told they conducted a drill just last week, but the hospital tells us the CDC has been continuously changing plans with responding to Ebola in the country. So Saratoga Hospital says the response plans our local hospitals have in place right now could completely change in the coming days. The CDC has been more proactive, though, by getting healthcare workers across the country more training. And today, the CDC will be hosting a phone call conference with the American Nurses Association to talk about how to better prepare nurses for Ebola. Reporting in Albany, Jennifer Lee for News 10 ABC.